Okay, this is the third part of my cancer Q&A, where you gave me some questions and I'm working my way through. This will be the final part for now, but please, 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 please give me more questions. The questions are just massively helpful. It makes me think about maybe things I hadn't thought about. Really helpful for other patients and hopefully interesting for you as well. So yeah, find me on Facebook and send me a question or comment on this video with a question, and I'll do a reply video soon. Okay, so a couple of topics from my friend Kirsten. So first one, she said, what is your top advice you tell everyone about cancer? Is it, for example, to get a colonoscopy or to change something? Is there any screening you advise? This is an excellent topic and a very difficult one. And the first thing is, it makes me realize I just have not been going around telling people stuff they should do. Maybe that needs to change. I'm definitely going to think about that. I mean, being fit and healthy lowers your cancer risk to some extent. Obviously, fit and healthy is, you know, they are subjective terms, I guess. One thing that's much less subjective is if you do happen to get cancer, and on average 40% of people will, and I think that's something like a third of all women and half of all men will get cancer at some point. Being fit and healthy means you tolerate the treatment better, which potentially lets you have more treatment, more chance of a cure, more treatment options. So I'd say, I mean, it's good to be fit and healthy so you can enjoy life. That's probably a better reason than a cancer thing, and being, being physically fit and healthy does seem to prevent a wide range of diseases, or if you do get certain diseases, it makes the impact of them less on your body and on your life expectancy. Screening is a really interesting thing. Always my reflex is like, yeah, of course everyone should do screening. The reality is screening does not work very well. It really, really doesn't. Talking about now in 2024, hopefully it will change dramatically in the next few years. But currently screening does not work well for cancer. That's because of false negatives. So screening where someone gets screened and the cancer is not picked up on. And of course false positives as well. And that's more common in certain types of cancers. And the problem with a false positive is then the person may then get into the system and be having like further tests. So screening is never kind of you have cancer or you don't have cancer typically. Well, no, never. It's always, oh, you should do more testing because the screening's kind of showing something or showing a risk of something. But the problem is if you don't have cancer and the screening suggests more testing, and those tests also give false positive results, you get to a point where you may have to actually start something like a surgical procedure, and they start it and they do like in the surgery, there'll be in surgery testing where biopsies or stuff are taken, and then it's like, oh, you're given it all clear. Well, that's, I mean, to go into surgery is a really serious thing, and surgery has risk. Even biopsies, just doing like a needle biopsy, there's issues associated with that. So yeah, screening at the moment is not great. that's because of the screening and also because of what comes after. So radiography needs to improve, all your blood testing needs to improve. And hopefully at some point in the future, screening will be mainly done by advanced blood tests. So tests looking at circulating tumor cells or, free DNA floating around in the blood, that kind of thing. Or things like the N-nose test, where a sample is taken and could be like a blood sample or urine sample, and some special genetically cloned nematode worms suggest if there's presence of cancer or not. And hopefully radiography will improve as well to better pick up smaller things, and also to be able to be more certain of what is cancer and what isn't. And maybe some of that will be AI driven, where there's massive data banks of tumors and what they look like and properties. Or maybe there'll be more powerful scanning, like multimodal scanning technologies, where you have one scan but it's actually doing a whole bunch of different things, and then that could be interpreted automatically or by a human and give a much more definite yes or no. Colonoscopy, colonoscopy absolutely worth doing, because colon cancer is one of these odd ones, a bit like skin cancer, where if it's picked up kind of almost pre-cancer, it can be treated and you don't get the cancer. It's kind of amazing. So you can have a situation where colonoscopy found some polyps, so some little growths in the intestine, and they can be removed during the colonoscopy, and then they're tested, and then they say, they weren't cancerous. Well, one of those could have turned into cancer. So by having a colonoscopy to check if you've got cancer, you've kind of prevented yourself getting cancer, which is incredible. So colonoscopy makes sense. Definitely makes sense having it earlier than. The general rule is whatever the recommendation is in your country, maybe take 10 years off that. So if they're saying like people over the age of 55 should have a colonoscopy, then do it at 45, whatever. And then, so another piece of advice that I would like, a really important piece of advice, is just keep an eye on your body. When we're young and really active, we're kind of indestructible, and we don't, you're just going for it every day. And as you get older, it's really important to keep an eye on things, and maybe without being crazy about it, like note stuff down in your diary. If you just weigh yourself once a week, write that down in your diary, and if your eating is normal and you start experiencing weight loss, then that's absolutely a reason to go and talk to a doctor. Hopefully not cancer, but unexplained weight loss is a sensible thing. Obviously the self checks are really, self check for like breast cancer and stuff, really sensible. Some just regular health check makes sense. So here in Japan, one of the reasons Japanese people live a very long time is the annual health check. So most people get a health check every year. I think it's over 40. So the local government sends you a postcard, and you go in and have a very, very basic health check. It's not free, but I think like my local government charges 500 yen, which is, I think that is currently £2.80 in British money. And whatever that is, a few euro, a few dollars. So and it's a very basic health check. It's like a blood test where they just look at liver function and a few other things. Chest x-ray, a urine test where they look like at a few things, maybe blood sugar level test, chat with a doctor, physical check with a nurse, that kind of thing. Really basic health check, but yeah, countries that don't have an annual health check, it's just stupid. I mean, yeah, if they had it in the UK, it would transform the health system apart from anything else. In Japan, companies often will pay for, or larger companies will pay for, a much more comprehensive health check called the Ningen Doku. Human dry dock is what it translates to. And if your company's really rich, that will include a PET scan. PET scans are expensive even in Japan. In the US, a PET scan is something like $14,000. In Japan, it's much less than that, but still a lot of money. And you'd also get your colonoscopy and a gastroscopy, so kind of stomach cancer. And again, a stomach camera, looking for possibly stomach cancer, but also just ulcers or that kind of thing. Gastroscopy is really worth having. I mean, doctors tell me that, basically, if you're in like mid-40s onwards, you should really do a gastroscopy and a colonoscopy every year. So being aware of your body and writing stuff down, I guess, is a big deal. And if stuff is changes unexpectedly, see a doctor about it. I don't want to upset anyone, especially cancer patients, but as cancer patients, we have stories, and we hear many stories about symptoms being ignored. Like, I kept going to my doctor and saying, I had pain in my chest, and it turned out I had a bad heart, and the doctors ignored me for years. I mean, it would be remiss of me not to point out that the vast majority of things that happen with our bodies are like completely normal. I know that that's not something you want to hear, but it's really true. So regardless of whether that upsets people or not, almost all chest pain is what's called muscular skeletal pain. So it's like aches and pains in the muscles and connective tissue. It's from things like picking something up, twisting, or whatever. If you have an upset stomach for quite a while, that's often just some bacterial thing that can't be shaken. Still see a doctor about it, of course. But most rectal bleeding is hemorrhoids, not colon cancer. But I know that it's kind of upsetting to hear if you had something that was dismissed as hemorrhoids for many years, and finally diagnosed with stage 4 colon cancer, and given a couple of years to live. But yeah, the reality is that our bodies are good at taking care of themselves generally, and in the vast majority of cases, like symptoms. I mean, this is again one reason why it's difficult to find cancer with screening, for example, is that generally when there's symptoms, that means the cancer's spread already. And if you look at the whatever cancer it is, look up whatever cancer you like with the words warning signs or something. So colon cancer warning signs, and you'll get a list of warning signs, and they're all associated with loads of health issues and with also kind of just temporary insignificant things anyway. So yeah, it's tricky, but yep, great topic, Kirsten. Thank you for that. Okay, here's a question from Angie. I may have answered this in a previous video, I can't remember, but I'm going to answer it again anyway. Are you able to eat at the moment, and what sort of foods? I am really struggling with eating at the moment. I mean, it's getting scary, really, really scary. I've lost like 6 kilograms in 5 weeks, which is medically dangerous. And is very dangerous as a cancer patient. And that, I think, is because of been taking opioids, opioid drug called Oxycontin, just like 50% more powerful than morphine. And that's because like with pain caused by cancer, like regular painkillers just don't seem to touch it. So even though my pain's mild, because it's cancer pain 24 hours a day, I've had to take the opioids just to be able to sleep and stuff. And big side effect of the opioid is loss of appetite. Also, the chemo pills I'm on, Lonsurf, major side effect is loss of appetite and also nausea and fatigue. And I'm sleeping badly, which makes it difficult to eat as well. And because of the heavy fatigue, I can't do much in the day. So again, means I don't have a lot of appetite. So yeah, currently really struggling with eating. Yeah, I like just the idea of having a meal is hard. It's kind of the idea of having like 2 or 3 meals in a day, that just seems beyond my ability at the moment. So I'm surviving on, well, no, I'm not surviving, I'm losing weight, and it's gonna get really bad soon. One thing we have in Japan is this stuff, it's just called energy jelly or sports jelly. So these are like little packs, like a sachet pack with a built-in straw. And you get them in any convenience store or pharmacy or supermarket, whatever. I guess it weighs a couple of 100 grams, maybe 150 grams. They are between like 100 and 180 calories usually. So I'm getting the 180 calorie ones, and it's like a kind of a glucose jelly with allegedly like a balance of vitamins and minerals. You can also buy kind of more higher end, more pharmaceutical type ones, which I don't know if they're any better, but yeah, so they're those. Protein drinks are an option. I kind of struggle with them. A friend has just given me like a protein powder mix, like whey powder and the vitamin balance thing, so I'm going to try that. But yeah, I really struggle with that kind of stuff. And yogurt, yeah, yogurt is probably the only normal thing I can really eat at the moment. Yeah, and like on a good day, I might manage 1 meal in a day. If it's yeah, yeah, that's it really. Ice cream, I guess. Yeah. So at the moment, it's a real problem. When I'm doing okay, then eggs are my big kind of go-to food. Eggs contain whatever it is, 12 out of the 13 essential vitamins that humans need, I think. So kind of scrambled eggs or whatever. Yeah, that's up till now, that's been a really big thing. At the moment, I'm even struggling with my eggs. Yeah, so yeah, food is really, really tough at the moment, and I'm in trouble and quite frightened about it. Okay, next question. what do you think should be different about how treatment options are decided for cancer patients when they're first diagnosed? Great question. I think it should be completely different, of course. Generally, the oncologist should say to you, either, your cancer's been found at an early stage, we're going to choose treatments to try and get you to no evidence of disease quickly, and then some ongoing treatment and follow-up to make sure the cancer doesn't come back. Or the oncologist would say, your cancer's been found at a late stage, we're going to get it under control as quickly as possible, and then either try and get you to no evidence of disease, or keep it under control so that it's stable or even shrinking over an extended period of time. So I think that should be the general approach. And then, the big thing is, like, if a treatment is low risk to the patient and doesn't reduce their treatment options in the future, then those should be the go-to ones, even if there's a more effective, higher risk treatment generally. So what I mean is, if you have a treatment where you can try it, and if it doesn't work, it hasn't done much damage, and you can still have another treatment, then that makes sense to do. So things like, if someone has a liver tumor and it could be treated with non-invasive or minimally invasive treatment, so something like ultrasound treatment, so this new HIFU or histotripsy, or something less invasive, but less invasive than surgery, like RFA or whatever, where like a needle is inserted into the tumor and heated up with radio waves to destroy the tumor, then that should be done instead of going for liver surgery. And oncologists will argue about that. Liver surgeons will definitely say, well, surgery is the gold standard in cancer care, and of course you should do the liver surgery. But surgery is a really big deal. I mean, I've had 3 big surgeries. It's massive for cancer patients. It puts a lot of stress on your immune system afterwards. Yeah, they are wrong and I am right, I have to say, on this. And that's really an economic thing. That's a thing where doctors have been brainwashed into into saying something which is based on an economic thing, not a clinical thing. And I've come up against that many times over the past 8 years. Where and I know this because I've looked at the papers on this stuff, so it's not like wishful thinking on my part. It's like I've looked at the papers and seen that there are treatments where a few patients may get a good result and the treatment is not particularly damaging, other than in economic terms, and doesn't get approved because or doesn't get approved as like a first line therapy or whatever because it's not seen as cost effective. But as a patient, if it's not going to damage you much and you want to try it instead of doing something that absolutely will damage you, still, I mean, there's this huge problem in the medical system of just people in the medical system underestimate the impact of surgery. Absolutely. They absolutely do. I've had 3 big surgeries in the past 8 years. It's a really big deal. A really big deal. And yeah, unfortunately, I guess surgeons culturally have a lot of power because of their position in the medical system. And people don't talk to patients enough, and maybe patients as well, we're not good enough at kind of putting into words what it's like once you've had surgery and like your body just never feels right again afterwards. Okay, another one from my friend Angie. Do you have an idea of a different model for deciding how many and which treatments are worth providing from an institutional or governing body sort of perspective? So yeah, I mean this is an economic thing, and it we have to start from a position of honesty where we admit that economics is largely nonsense, and that it's about deciding what we prioritize and what we don't in society, or within cancer care, or within whatever you're talking about. We know we have to decide what to prioritize and then arrange the numbers around that. And again, I've seen this so many times where, because I'm very curious about cost of treatment, so I'll see this non-invasive treatment or minimally invasive treatment, and I look at the price, and the price is like suspiciously close to a competing treatment, where these two treatments have no relation, like they're done in a completely different way, but basically they're working to an artificial budget, because they're like, if we can make our treatment similar in price to this other treatment, but our treatment is a bit better, then yeah, it will be used. So yeah, my different model is decide what we need to do and then work really, really, really hard to make it cheap, commonplace, widely used, as applicable to as many situations as possible. So if we take any treatment, so recently I'm obsessed by HIFU, high intensity focused ultrasound. We should work on the technology to make it cheap, work on the process of delivery to make it cheap. So look at all the different costs involved in actually giving that to a patient, and work out how to minimize all those costs while still keeping it safe and effective. And then we should ruthlessly look at where it can replace other stuff. So it's a good replacement for, maybe radiotherapy in certain situations, maybe surgery in certain situations, and be absolutely ruthless about that, and really, really work hard on, how can you modify the treatment or perfect the treatment or deliver in a slightly different way so that it can replace a whole bunch of different surgeries or a whole bunch of uses of radiotherapy. So that would be my model. And I think that applies to, it particularly applies to cancer treatment, because cancer treatment is so ridiculously expensive because of the research and development costs, not because of the cost of manufacturing the drug, which is minimal, or even the cost of the machines, which is kind of expensive, but no one makes any effort to reduce the cost of the machines. Yeah, so that would be my model, and I think that applies to all areas of medicine, and obviously I think it applies to all areas of society as well. If something's good, we should push it and push it and push it and push it and push it. And we don't, and we don't, and the honest answer of why we don't is because we're dumb. Humans are really, really dumb. There's a quote wrongly attributed to oh God, I forgot his name now. Anyway, the quote: "Man shapes his tools, and in time, his tools shape him." And Marshall McLuhan is the person who is wrongly attributed to, but I think Marshall McLuhan quoted that many times or whatever, and it is the most true thing that has ever been said ever. It's really, really true that we come up with awesome stuff that could make the world better, and yeah, and you know, to some extent we use tech well, but generally we water it down, or we don't want to be uncomfortable, so we get this cool stuff and we let it get twisted out of shape to fit our way of doing things. And there's so many examples. I mean, yeah. You know, if you look at the history of books, like books, it took ages for books to have covers on, and then it took an insane amount of time for people to separate the idea of a physical book and then like the contents of the book. Humans just couldn't grasp that these are different, and or could be treated differently. Yeah, so we need some courage. When, you know, if we find a treatment that is good, we should really pursue it hard. And I guess another reason why this doesn't happen is shiny object syndrome, where we get distracted by the next thing. And, you know, I feel so sorry for when I talk to cancer patients and they've heard of something and that's allegedly coming. Loads of people would talk about mRNA vaccines, and oh look, it did so well with COVID, and surely this is going to be the big thing in cancer. I predict it's not going to be the big thing in cancer. We'll just say that. There are issues with using messenger RNA that, you know, it gets trashed immediately when you put it in the body, right? I mean, it gets broken down by enzymes and stuff, and then so your big thing is to make some kind of like protective shell or whatever for that, and then there's maybe toxicity associated with that, and the results of where the RNA go can be unpredictable and stuff. And yeah, but yeah, in oncology, people are just moving on to the next thing all the time, instead of finding something that works well or very well or quite well in a certain area, and then really pushing hard on expanding its use. In medicine, people always want lots of options, and they want lots of options because treatments don't work very well, and because there's often side effects, and you may need to switch something else because of the side effects. That's not good. That's just not good. Much better to have stuff that works quite well, with minimum side effects, and then work on making it being applied more generally. I mean, you see the kind of cliche at the moment, it's throwing AI at everything. That's a big topic, but the general idea is kind of good, that, you know, if you have something, you know, if you discover fire, then, you know, you could use it for cooking, you could use it for making clay pots, you could use it for lighting, for heating. You'd be really dumb to like you just use it for one thing. Okay, that's probably not the answer you wanted, but yeah, so I will stop there, but please, more questions. Yeah, they are more valuable than I could ever say, and thank you for watching.